Arthritis is a term many people have heard, often associated with the aches and pains of getting older. However, it is much more than just a simple ache. The word itself means joint inflammation, and it describes over 100 different conditions that affect the joints. Joints are the clever parts of our body where two bones meet, allowing us to move, bend, and twist. Think of your knees, hips, fingers, and wrists. When arthritis strikes, it causes pain, stiffness, and swelling in these crucial areas. This can make everyday activities, like opening a jar or going for a walk, much more difficult and sometimes very painful. It is important to understand that arthritis is not a single disease. Instead, it is a broad umbrella term for a family of related conditions. While they all affect the joints, they do so in very different ways and for very different reasons. Some types are caused by simple wear and tear over many years of use. Others are the result of the body's own defense system, the immune system, mistakenly attacking its own tissues. And some can be caused by infections or the buildup of certain substances in the body. Understanding the specific type of arthritis a person has is the first and most vital step towards managing it effectively. The most common types that we see are osteoarthritis and rheumatoid arthritis. These two conditions account for the vast majority of cases in the UK. While their names might sound similar, they are fundamentally different in what causes them and how they affect the body. Imagine your joints are like the hinges on a door. With one type of arthritis, the hinge simply wears out from being used millions of times. With another, the hinge is being actively damaged by a fault in its own protective system. This distinction is crucial for doctors when deciding on the best course of treatment for a patient. Although arthritis is more common in older adults, it can affect people of all ages, including children and teenagers. The impact on a person's life can be significant, limiting their mobility and affecting their ability to work or enjoy their hobbies. It can lead to feelings of frustration and isolation. That is why raising awareness about what arthritis really is and what causes the pain is so important. By understanding the condition better, we can offer better support to those living with it and work towards finding more effective ways to manage their symptoms and improve their quality of life. Osteoarthritis is the most common form of arthritis in the UK, affecting millions of people. It is often described as a wear and tear condition. Think of the cartilage in your joints as the protective tread on a car tire. Cartilage is a firm, rubbery tissue that covers the ends of your bones, acting as a smooth, slippery cushion. It allows your bones to glide over each other with very little friction. Over many years of movement, this cartilage can gradually wear down. As the cartilage thins, the smooth surface becomes rough and pitted, a bit like a road surface developing potholes over time. This gradual wearing down of the cartilage is the primary feature of osteoarthritis. As the protective layer disappears, the bones in the joint can start to rub directly against each other. This bone-on-bone contact is what causes the characteristic pain, grinding sensations, and stiffness that people with osteoarthritis experience. The body may try to repair the damage by growing extra little bits of bone, called osteophytes or bone spurs, around the edges of the joint. Unfortunately, these spurs can make the problem worse by causing more pain and further restricting the joint's movement. Several factors can increase your risk of developing osteoarthritis. Age is the most significant one. The longer you use your joints, the more wear and tear they accumulate. Genetics also plays a part, meaning you are more likely to develop it if your parents or siblings have it. Previous joint injuries, perhaps from sport or an accident, can also accelerate the wear and tear process in a specific joint. Being overweight is another major risk factor, as it places extra strain on weight-bearing joints like the hips and knees, causing the cartilage to wear away more quickly. The joints most commonly affected by osteoarthritis are the ones that carry the most load or are used most repetitively. These include the knees, hips, the small joints in the hands, and the spine. The pain often feels like a deep ache, which can be worse after activity or at the end of the day. Stiffness, particularly in the morning or after a period of rest, is also a very common symptom. Unlike some other forms of arthritis, osteoarthritis typically affects just one or a few joints rather than many joints all over the body. Rheumatoid arthritis is quite different from osteoarthritis. It is not caused by mechanical wear and tear, but is instead an autoimmune condition. In a healthy person, the immune system is a brilliant defense force, identifying and attacking foreign invaders like bacteria and viruses. In someone with rheumatoid arthritis, the immune system gets confused. It mistakenly identifies the body's own healthy tissues as a threat and launches an attack against them. Specifically, it targets the synovium, which is the delicate lining that surrounds the joints and produces a lubricating fluid. When the immune system attacks the synovium, it causes inflammation. The lining becomes swollen, red, and painful. This inflammation is the root cause of the symptoms of rheumatoid arthritis. If the inflammation continues without being controlled, it can do serious damage. It can erode the cartilage and eventually, even the bone itself. This can lead to the joints becoming unstable, misshapen, and losing their normal range of movement. This is why early diagnosis and treatment are so critical in rheumatoid arthritis, to stop the inflammation before it causes permanent, irreversible damage to the joints. Unlike osteoarthritis, which often develops slowly over many years, rheumatoid arthritis can sometimes appear quite quickly, over a matter of weeks or months. It also tends to be symmetrical, meaning if a joint on one side of the body is affected, the same joint on the other side is often affected too. For example, both wrists or both knees might become painful and swollen at the same time. The condition can also cause more general symptoms, such as tiredness, a high temperature, and a poor appetite, because it is a systemic disease that affects the whole body, not just the joints. The exact trigger that causes the immune system to go wrong in rheumatoid arthritis is not yet fully understood. However, we know that certain factors increase a person's risk. Genetics is one. Having a specific gene makes you more susceptible. It is thought that an environmental trigger, such as a virus or infection, might set off the condition in someone who is already genetically predisposed. Smoking is another very strong risk factor, as it is known to have a significant effect on the immune system. It is also more common in women than in men, and it most often starts between the ages of 40 and 60. While you cannot change some risk factors for arthritis, such as your age or your genetic makeup, there are many practical steps you can take to look after your joints and lower your risk of developing certain types, particularly osteoarthritis. One of the most important things you can do is to maintain a healthy weight. Every extra pound of body weight puts about 4 extra pounds of pressure on your knees and 6 extra pounds on your hips. Losing even a small amount of excess weight can make a huge difference, reducing the strain on your joints and slowing down the wear and tear on your cartilage. Regular exercise is also absolutely vital for joint health. It might seem counterintuitive to exercise if your joints are sore, but the right kind of movement is incredibly beneficial. Exercise helps to strengthen the muscles that support and protect your joints. Strong muscles act like shock absorbers, taking some of the load off the joint itself. Activities like swimming, cycling, and walking are excellent because they are low impact, meaning they do not jolt the joints. It is also important to include exercises that improve flexibility and range of motion, such as stretching or yoga, to keep your joints from becoming stiff. Protecting your joints from injury is another key preventative measure. If you play sports, make sure you use the correct equipment and technique to minimize the risk of sprains, strains, and fractures. If your job involves repetitive tasks or heavy lifting, be mindful of your posture and use proper lifting techniques to avoid putting undue stress on your back, knees, and other joints. A single bad injury can significantly increase your chances of developing osteoarthritis in that joint later in life, so prevention is always better than cure. Thinking about joint safety in your daily activities is a smart investment in your future health. Finally, while this essay has focused on osteoarthritis and rheumatoid arthritis, it is worth remembering that there are many other forms, such as gout, which is caused by a buildup of uric acid crystals in a joint. For all types of arthritis, a healthy lifestyle is beneficial. Quitting smoking is crucial, especially for reducing the risk of rheumatoid arthritis. Eating a balanced diet rich in fruits, vegetables, and omega-3 fatty acids may also help to reduce inflammation in the body. By taking these simple, proactive steps, you can give your joints the best possible chance of staying healthy for longer.